So good morning to you all and welcome to our webinar today on building a resilient safety culture, doing safely differently webinar. My name is Elaine Murphy and I am the organisational psychologist here in the Health and Safety Authority, and I'm delighted to be joined today by Marion Kiely from Pepsico and Colleen Butler from the HSA, and I will introduce them further in a moment. Before we begin, just to advise of the format of this morning, this webinar will be recorded so you can watch it later when it'll be uploaded to our website. You will get an email this week after the webinar with the slides and a link for the recording. And also, I suppose this is a topic that we will be engaging with further. So we have added a question to the email that will go out asking you if you want to engage with us further on that topic. So that would be greatly appreciated. In terms of today's presentation, Colleen and Marion will each give a 10 to 15 minute presentation. And after this, we're just going to change the format slightly then to have a fireside chat session, because we think this is such a good way to give you, the audience, more insights on the work of Marion's project and the work that Colleen does as well within the authority. You will have an opportunity then at the end. We'll have a question and answer session and we'll go through that with everybody. So as the webinar goes on, we have a dedicated Q&A box at the top of the screen, the Q&A chat. So if you want to put your questions in there, and I'll be monitoring it as we go along throughout the webinar. And again, you'll have time for questions and answers session at the end. So that's the format for today. So we're delighted to welcome Marion. And Marion is the EHS Culture Lead of Pepsico, based in Ireland and supporting the PGCS manufacturing sites and distribution centre across several continents. Marion joined Pepsico in 2022, having previously worked in Upstream, which was a health and safety consultancy that she founded in 2015. Prior to that, Marion spent 15 years working in the pharmaceutical industry. And again, some interesting facts about Marion, that she actually went through the education route as a mature student and has completed several courses, including the MSc in occupational health. She's an advocate of safety differently and anthro-complexity, and describes herself as perpetually curious. I love that one. I think that really sums you up, Marion, and trying to make sense of our world and how we interact with it. So that's our introduction for Marion today. And I'm also going to introduce Colleen before she speaks. Dr. Colleen Butler is our Human Factors Specialist here and inspectors within our behavioural health and safety team here in the authority. And central to Colleen's work is the promotion of human factors and systems thinking to really support that health and safety behaviour change, something that we are continually looking at. Prior to this, Colleen worked in psychology and human factors, in research providing in the regulatory support at the Research and Science Division in the Health and Safety Executive UK. So we are lucky that she decided to come home to Ireland to us. And she's a Chartered Human Factors Specialist with the UK Chartered Institute of Ergonomics and Human Factors, and also a committee member here of the Irish Human Factors and Ergonomics Society. So such a valuable subject matter expert here for us. And Colleen, if you're ready to go, I'll hand over to you. And thanks very much to Marion and Colleen in advance of your presentations. Thank you.
Thanks, Elaine. Okay, so I'm going to just crack on with my slides here. So the aim of, I'll just go back to this slide. So the aim of what we are doing today is, so I would like to spend the next hour or so on this topic of safety culture and encouraging work on strengthening safety culture. And secondly, then, to raise awareness of some of the practical tools and the actionable steps to support improvement. And the way I'm going to do that is I'll be referring to some of the safety culture tools and methods that are out there. So drawing on some of the work from others in these areas, including the Health and Safety Executive in the UK and other institutions. I will be then talking about safety culture maturity, I'll be touching on safety to thinking, and then I will, of course, we'll be going to Marion and looking at the case study side of things. So yeah, hopefully that will prove to be an interesting hour or over session for you over the next hour. And why are we doing any of this? Because good safety culture work is good safety culture work, when it's done really well, identifies the levers for change, and it uses this information then to take forward actions and improve health and safety outcomes. So that's why we're doing any of this safety culture work. We know that it can really help to improve health and safety outcomes. One of the things that we want to do today is also tell stories. So that's one of the reasons why we feel like it's important to include the case study, and not only tell stories within that case study, but really focus on some of the practical steps. So my section of the presentation will be a combination of theory and some practice, but then when Marion speaks, we'll be talking more about some of those practical steps that you can take to address safety culture. But before we go into that, I am just going to make sure that we're, I suppose, all on the same page when it comes to how we view safety culture and how we define it. So I'm using the definition here of workers' shared perceptions and how of how safety is prioritized and how this influences safety-related behavior. And the 4 coloured boxes here below are what I would see as some of the key influencers on safety culture. So explaining safety culture can often be a bit like pinning jelly to a wall. So I find these kind of useful to break it down into some of these influencing factors. So visible senior management is about senior management commitment, rather, is about where safety is, where there are consistent messages around safety, and that is demonstrated in management decisions and actions. So as employees often infer organizational priorities from repeated patterns of managerial action, and this is particularly when safety competes with productivity, when it competes with efficiency or time pressure. Another key influencer here is worker involvement. So whether workers are involved, say, in the development of procedures and policies, are they involved in the development of risk assessments? Or organizational learning. How does an organization handle an accident in terms of the level of analysis they do in post-accident, and how they feed that back then to the workforce, and the implications for that in terms of what kind of culture might develop. So we did do a webinar on safety culture previously, which goes into more on these topics. So I won't expand too much, but if you do want to see more on these different areas, yeah, I'll put a link in at the end. There's a link in at the end of the presentation. Okay, so why are we doing any of this? Because we know that safety culture work brings about a number of benefits, and this is really shown in a number of research articles and case studies. So we know that the work can reduce accident and injury rates. It can reduce sickness absence, improve workforce morale, and as the slide there says, to sustain work performance, and also look after organizational reputation. And this is shown across sectors, whether research from aviation, from Eurocontrol. They've done lots of work on safety culture and shown some of these benefits, and too in the healthcare sector. And some of the research more recently published in the healthcare sector on safety culture comes from Mairead Finn from the Royal College of Surgeons Ireland, and she has shown published research there on the benefits of safety culture work. And you'll also see a number of case studies, one of which we'll talk about today. So before I go into talking about the methods, I want to make sure that we're just all on the same page when it comes to some of the terminology. Safety climate and safety culture, these can be used interchangeably as terms. And I just want to say a little bit about that before we go into talking about the tools. So safety climate, it can be regarded as a measurable snapshot of an organization's safety culture. So if you think maybe of safety culture as the personality of an organization, you could view safety climate as the mood. So it is a sample at a point in time. It may be way too difficult to try to attempt to say that you can measure safety culture entirely, because that may require something a lot more longitudinal and complex, and we may not be there yet in terms of being able to do that. But there are tools out there, and I'll refer to a couple of different ones here. So some of you may be aware of the safety climate tool in the Health and Safety Executive in the UK. They use a method whereby they seek to measure safety climate along these 8 factors that you can maybe work out on the left side of your slide there. So the tool is made up of approximately 40 questions, and they range in topic areas from resources for health and safety to accident and incident investigation to organizational commitment. And they then would come up with a score and results, a quantitative result from on each of those factors. What also, or another option there is from the Energy Institute. Some of you may be aware of the Hearts and Minds tool. Again, you can get more information on the Energy Institute website on this, but lots of different sources there on how to measure it from Hearts and Minds view perspective. But also what many are the approach that many are taking now is kind of using a combination of sources. So they are what I'm referring to here as triangulating results. So some organizations are now using a survey or a questionnaire. They're also running focus groups or workshops and interviews, and looking at maybe a sample of documentation or other lagging indicators, all trying to inform what the culture looks like. So that kind of triangulating results method is often an approach taken to. What some of these methods also recommend is using a kind of a cyclical process or a framework around any kind of safety culture intervention. So I'm referring here to, or the slide here uses a framework from the Health and Safety Executive. Their ASCENT framework, which stands for Achieving Safety Culture Excellence Now and Tomorrow. And a couple of the stages of their framework I'll just refer to here. In particular, the foundation level is often a level that gets left out of any safety culture work in that and this is an important stage, because what it's about getting senior management buy-in to do any safety culture intervention. It's about identifying your resources, potentially setting up a steering group, and maybe, most importantly, managing expectations from the beginning about what you can achieve and how long it's going to take. Another stage that I will just highlight here is the focus stage. Again, I think this can be a key part of any safety culture intervention. And what this is referring to is where you are taking that quantitative data from your survey. So you may have, like the slide shows there on the left, some kind of traffic light results. And digging deeper below those to find out, well, what do they actually mean? So you're really trying to understand the why behind your quantitative results. And that can be, in my view, a really important part of any safety culture work, is understanding why workers think the way they do, why do they have the perceptions they have. So, as I said, this could be running focus groups or interviews. And one of the reasons you're doing this is to get that rich qualitative information and really to guide your action planning phase, because that's where your kind of, I suppose, your solutions and your ways forward will come from. But I think there are a number of kind of good principles to adopt when running any of these kind of sessions, whether it's a focus group with, say, 8 to 12 workers, or running interviews, maybe on a one-to-one with senior management, is to ensure that anyone who is participating, a sample of the workforce, that you're giving them information beforehand to make sure that they feel assured of what they're going into, and are more likely to be open and honest in their sharing of perceptions of different facets of safety. So you are trying to manage expectations about what the session will cover and how long it will last and where it will be, and all those things that people want to know before they get involved in any kind of consultation exercise. Important to make sure you're structuring your discussion around the relevant topics that have come out of whether it's a survey or some other work that you have done, and that you make sure there's room for going off piste if you need to. So keeping your discussion like in a semi-structured kind of format. Also, the composition of who's involved in any single focus group is an important thing to think about. Some workers may not want to, or may feel more hesitant, understandably, perhaps, to not be in the same group as a manager or a supervisor, and may be more inclined to be open and honest with their views when the group is composed of people within the same role or level within the organization. I would also see these group sessions or consultation exercises as an opportunity to let the workforce, yes, air bad news and say what they think of, what their perceptions are of various aspects of safety. But it is also an opportunity for identifying some of the good stuff and, what good is going on. So yeah, I think those are some key things to think about when we're looking at digging deeper behind any of the safety culture work that we're doing. So the results from your safety culture work, they can be used to plug into a safety culture maturity model. Now, there are lots and lots of versions of different models out there. I'm happy to provide one here from the Energy Institute, their Hearts and Minds, what they use in the Hearts and Minds model. Not tied to any of these in particular, but just to say that these are generally, lots of the models are formulated just as this is shown. So they're 5 steps on a ladder, and they tend to give a descriptor of safety culture from a really poor safety culture. In this case, it's termed pathological, right up to excellent safety culture. And in this case, they're calling it generative. But yeah, there's lots of different versions of these tools out there. So in the case of a very poor safety culture, it's often characterized by where there's almost like a firefighting approach to safety. So, it's not where any of us want to be. And then as you go up the ladder, it becomes less reactive and more proactive. And now there is some criticism of some of the the use of safety culture models, in that people do criticize them for being theoretical. But I would see them as something that you can use on your journey, for want of a better word, safety culture journey, to help, guide you, or identify where you might go next, or what else can you achieve in that continuous improvement. So because it's all about continuous improvement, isn't it? So I think they are a useful way of characterizing where you might be on safety, but as long as you're just using them in there, an indicator of where you might be. So I said the generative stage there, what safety culture excellence looks like. We could also draw on some other research that the Health and Safety Executive have in the UK have carried out. So it refers to HROs. Some of you may be familiar with this work, but basically this you could use some of the characteristics from this as to say what an excellent safety culture looks like. So an excellent safety culture being one where there is a learning orientation. So there's that, root cause analysis and identification of factors. So it's this organizational learning. There's what's referred to maybe as a mindful leadership, so bottom-up communication of bad news, and just culture. So individual accountability, ability to abandon work on safety grounds. So again, these could be things to aspire towards and aim for in your journey. And finally, I said I'd touch on some of the safety to thinking. So what this slide shows, and what some of the safety to work talks about, is that we should really be looking at the full picture of safety. So some of the thinking here is that we spend an inordinate amount of time on focusing on safety one, so the accidents and the incidents, when so much of what happens under that curve, the curve of safety performance, is things not going wrong. And in fact, not only things not going wrong, sometimes things going really well. So if you look at the more right-hand side of the bell curve there, that's the bit where I'm talking about things going really well. So, but one of the authors of some of this work, Eric Hollnagel, is trying to encourage really us not just to focus on so much effort on the safety one, but look at what happens in that, what might be referred to as unremarkable, because it's almost a non-event, that big part of that's under the curve there. It is safety, it's dynamic, non-event safety, but it's where the normal everyday work occurs. So the argument is that we can learn a lot more there from normal work, and not just looking at where things go wrong. Okay, so my key messages then are, as I said at the top, good safety culture work finds the levers for change and can action them to positively impact health and safety outcomes. And some of the principles I've talked about here are around using multiple sources to inform your assessment. So that's quantitative and qualitative. Understanding the why to guide your action planning. Any data, any information that you do draw on in relation to perceptions or other data that you get. We really need to be digging deeper into why people think the way they do. And then the idea of using a safety culture maturity model, I think they can be useful, because it's a way to kind of map out where you might go next, or what you might concentrate on. But bearing in mind they are indicative only, and that we can learn from not only what goes wrong, but also from normal work. So taking account of safety 1 and safety 2. Okay, so I am going to just refer now to some resources. So you're aware of some of the resources that are on the Human Factors website, HSA website, from some information around safety culture. There's a webinar we gave previously on influencing safety culture, and also the case study that we're just about to hear about from Pepsico is on there. I'll also refer to some of the other resources on there that, whether from the Institute, EU, OSHA, there are links to resources from the Health Service Executive here in Ireland around developing organisational culture, and some of their work on just culture too, as well as reference to some of the aviation work on safety culture. Okay, so I'm going to finish there, and I will hand you over to Marion now, where, just to reiterate again, this case study is on the Human Factors section of the HSA website, so you can read it there in full, but Marion's going to tell us more about that now. So I will stop sharing my slides.
Great, thanks Colleen, thanks a million. I will bring up my deck there now as well, so hopefully you can see that. So I'm just here to present on the I suppose the Courage to Care program that we are running in Pepsico, which was in motion for a while before I joined the organisation. So I'm here to present on the great work that has been done by our teams at our sites and distribution centres. They're doing amazing work, so I'm just here to tell their story really in where we are today and some of the inroads we're making. So I would just like to extend, as we'd say here, a céad míle fáilte. I was absolutely delighted when Colleen reached out with an interest in the work that we were doing on our Courage to Care programme. So obviously the case study is up on the Health and Safety Authority's website. And as I was saying to some leaders during the week, our profession in health and safety, I don't think we ever arrive at our destination. We work very hard. We hope for the best, but we plan for the worst. So it's we're constantly on a quest, and we just need to be careful that we're not saying, oh, we've reached that end point, because we're always striving. We have to be on tenterhooks for the emergent hazards that are constantly coming, and the our busy work sites and what's influencing externally, internally in how we do our work. So on that, I'm just going to present here on some underpinning theory and our own guiding principles, a little bit on communication and the importance of that, and learning from normal work as well, which Colleen referred to there in her deck as well. So, and Colleen did put in the ask to me. She said, look, I am going to be covering a bit of theory. If you could get into some of the practicalities, what is it that you have done in trying to roll out this programme, and what are some of the challenges, what are some of the successes? So that's kind of where I'll be honing on, as opposed to a lot of the theory. But however, I will just call out some of the theory that has influenced the work that we do. So I suppose many people on this call will recognise Eric Holnigal, Sidney Decker, Todd Conklin, and their work and contributions via Safety 2, Safety Differently, and Human and Organisational Performance. And they've such an amount of information out there. I think it was 2015 was the first time I went on a week-long masterclass on human factors and safety with Sidney and RJ de Boer, many moons, over 10 years ago now. And we went over to Castile de Har over near Utrecht, and it was just brilliant, and it was just a game changer. And at that time, Sidney called out Dave Snowden and the Kinevin framework. So that December, I went over and done a week-long masterclass on the Kinevin framework and sense making. And I have down here anthro-complexity. So that's applying complex adaptive systems theory to human systems. And I think it's so relevant. So Dave's work is amazing, and I'd encourage anyone to check out his work on the Kinevin framework. I use the methods developed by Dave in the workshops that I deliver in the sense-making piece. And I think it's really, really important. And I'm going to touch on that as we go through, but it's just, there needs to be a resonance. So we need to give people time to take on, we're presenting, I suppose this is a phase shift really. And the first time that I actually ran one of these workshops for one of our sites, it was a day-long workshop on health and safety. So you can imagine, you have team leads and supervisors and managers being asked to come along. And typically over the years, this is in many organizations, people expect that they're going to be hearing about legislation and, all the things that they need to do, their duties and what have you. Whereas we presented on this changing, I suppose, this new view in safety, and really showed that, like, telling the story, and I've said this, like, stories are so important. When we look at health and safety and we look at the origins of it, we look back to the legislation that was started in the early, or that was first passed in the early 1800s, that was to better society at the time, whereby we had, children working in mills and mines and working night shifts. So thankfully, in this part of the world, that's not the case anymore. But it's just looking at the foundation. So our premise was to improve, and we got so good at that. We got really, really good. And this is just at industry at large. You could see that injuries and fatalities had decreased. And so where our starting point was in looking after people, many organizations, then the metrics kind of came in. So it's just being mindful of that piece, and I have more to cover that as well. So this is really bringing it back to the origins of what health and safety is. And sometimes we say it's safety differently, and you have some people say, actually, it's not. This is where it started out. But it really is bringing it back to the ethics, I suppose, really, of what's underpinning health and safety, and just making sure that we're recalibrating to make sure that we're aligned with that. And I think it just comes with our profession, and that's why we do what we do, because of that ethical piece, that we want to actually make a difference and complement the business, and also making our workplaces safer as well. So that's just the underpinning theory there. These guiding principles are up on the HSA website. They're the ones that we use. And I suppose the number one here is that no news is not good news. Communication leads to action. And, many times we perceive when people raise items, that it's bad news. And I think we just need to flip that a bit. It actually is good news. It's providing us with an opportunity. And it's connected to number 3, where learning is vital. And if we're not learning, we're not winning. So it really is about psychological safety, making it safe for our teams to tell us where they see potential risk, where there's room for improvement, listening to that, taking action on it. And our response matters in that. So we can blame or we can learn, but as Sydney would say, you can't do both. And to quote Clive Lloyd as well, you can't fix a secret. So that whole piece of psychological safety is so important to empower our teams and enable them to tell us what used to be perceived as bad news, but now it's actually seen as a good news story, So error is normal as well, and just taking into account, instead of talking about human error, can we talk about human factors? Are our systems designed with the fact that there's human beings interacting with them, There's a whole piece there. We could spend a week actually just talking on this one on its own, but it's just bearing that in mind as well. Lots of talks on behaviour when we talk about safety with many approaches. And this is just my own view. I'm not saying it's necessarily the organisation's view, but when I hear behaviours, it's people love to talk about other people's behaviours, and yet if somebody talks to us about our behaviour, it's not something that we relish. So it's really trying to get to that adult style conversation, as opposed to what can be perceived as parent-child type conversations when we talk about behaviours. So it's just being mindful that people interact with a system in a certain way because of the system, the environment, and the culture in which they're in. And we're here, our Courage to Care programme, it does fall under the remit of our EHS, Environmental Health and Safety Department, but this is across the board. And it's my opinion that you can't have a great organisational culture and a poor safety culture, and vice versa. The two are interlinked. But we do have to go and try and measure our performance as to how we are performing. And I suppose typically we would have looked at lagging indicators and seen that no news is good news because injuries or worse weren't happening. Whereas now we're trying to go down that Eric Holnigal route, trying to see what can we learn from that normal work, the difficult work, and being curious about our systems, environment and culture and how they influence how people interact in the systems. Work, as imagined, is generally not the same as work as is done. So it's part of our makeup as human beings that we bridge the gaps. We don't have time to analyse every micro event that happens in front of us. So we actually fill the gaps based on our lived experience. So it's being mindful of that. We are biased just by the very fact, each and every one of us, because we're human beings. So it's really about being mindful of that fundamental attribution bias, when we're looking back in retrospect, being mindful that there's a bias there when we know the outcome of events, and just calling out that there is a difference between work as imagined and work as is done. And just giving kudos to people as well. Their people work safely most of the time, so it's trying to see the donut and what's present, as opposed to the whole, just that piece that's missing, so it's actually looking holistically at the system. And to be fair, we give people credit a lot of the time for getting the work done. So when something undesirable happens, it's trying to actually explore that and see, was this happening all the time and what was different in this one instance? But it's really about trying to learn, share those learnings and trying to improve. So these are our guiding principles, I suppose, within PGCS. And we were ahead of our corporate crew actually in relation to rolling out this Courage to Care programme. We had it called Culture-Based Safety at the time. So it was brilliant then, and I liaise regularly with the corporate team, and it's brilliant just to have that knowledge sharing. So actually, we have Courage to Care beliefs here, and you can see the 6 headlines. Our teams were really keen. They wanted to hang on to our principles. So our principles are actually embedded here underneath that, because some of them have really stuck, as in the no news is not good news, work is imagined, work is done. So I suppose the one thing we're guaranteed in our organisations, that we'll be changing, as we go, be it logos or what have you, and branding. But I do think this works quite well, and going out to our teams, especially number one, no news is not good news, communication leads to action. It's really trying to foster that. And it takes a bit of time for some of that to happen as well. So that's just a little bit on the underpinning theory and the guiding principles. Just a bit on communication there as well. And I just have a few little subheadings that I'll go into here when we look at that. So when I say the road less travelled, I'm just talking about when I joined the organisation initially. And this is just from my own perspective. Coming in, I wanted to be boots on the ground. I wanted to know what the challenges were, where the opportunities lay, to be able to talk the language, to actually be able to sense maybe some of, the challenges that might be there. So there's 2 options when you come in. And I think a lot of the time with health and safety professionals, we can have a lot of the theory and we're itching to get going. And we can see maybe some of what we're doing at our sites, that we'd like to change it. But it really is a journey. It's a kind of an evolution. And we can go the high road and we can come in as the expert and tell people what's not right. In my experience, in my career, I'm not going to give away my age now at this stage, but sometimes I would advocate that's not the best way to go. Sometimes to come in and go the edge shine route, the humble leadership piece, be humble, do that appreciative inquiry piece, get to find out what the challenges are, see it from everyone's perspective, from the operator's perspective, from the supervisors, the team lead's perspective, from the site director's perspective, from your executive leadership team's perspective, but to see it from all those perspectives, to see and to know what the challenges are. And it's not that anyone is right or wrong, it's just everyone is doing their best. But by helping them to make sense of some of the blind spots they might have known previously, it's just about planting seeds along the way here, about curiosity, about trying to shift that dial really. It's not flicking a switch, it's just about planting seeds around, for example, no news is not good news, communication leads to action. And it's about changing the narrative. If you're having morning meetings, and I mentioned this in the case study, I was business partner with one of the areas on the site that I worked in. And I would say, and this would be in many organizations, if you went back 20 years ago and somebody said, we had 12 events reported in that area, it could be a case of what's going on, what's gone wrong, that's not good. This would have been a bad news story. Whereas now it was just changing that narrative, saying, lads, you're leading the site. Thank you so much there for giving us an opportunity. And some of the stuff that you've raised, like, can you get involved with this? What are the solutions? Can you come on board? So it's about really nurturing that piece consistently, repeatedly, and over time, even people, because we have to acknowledge, and we can all remember organizations we might have worked in previously, where a bit of cynicism might come in, or action might have been taken as quick as we would have liked, and trust might be lost in a system. And these stories hold power in relation to how people interact today. So it's really just about making sure our video is aligned with our audio, we're consistent, We are genuinely curious. We are genuinely just trying to improve the safety at our site to try and reduce the risk. And that was the route I chose to go. And I do think with that route, then you can give people a bit of time, and it's basically having a bit of patience. You know, you're presenting this new approach, and just giving people a bit of time for that resonance, for some of that to actually filter through. And with that, then I think can come the change. The change isn't coming from the EHS team. It's not coming from you. It's actually coming from your site leadership team, for example. They're the ones who are actually calling out saying, I want that change. And I think that piece is important, to give people the time for that. So I have up here 0 as a philosophy versus the target. And I'm just looking at this from a research perspective as well. I suppose as a philosophy, I don't think there's anybody on this call or any health and safety professional that is not aligned with a 0 here as a philosophy, that we don't want anyone at our sites, in our organizations, out in our plant. We don't want one person getting hurt. We're absolutely aligned as a philosophy. This is the direction we want to go. We're doing everything that we possibly can to ensure that we end up getting this. What we really have to be mindful of, and the research is showing this when you look at safety science, when you set 0 as a target, then you can actually get workarounds. And here it can be, what gets measured gets manipulated. And I know that challenges what gets measured gets done. And we do have to have metrics, and we have to measure. But it's about being mindful of some of the pitfalls that other organizations have made. Some of them who were, up there in lights and then got blacklisted by the regulator, in their country. So it's just been really, really mindful of that. When we set 0 as a target, and I just want to give an example here. After one of our workshops for one of our sites, there used to be screens up saying there were so many days since the last injury or last recordable. And many organizations do this. And the intentions are good. It's to show that we have a really good, this is our record, and it's great. And it is great. When that's genuine, it's really good. But when you look at human factors then, and you look at social norms and how some individuals might be deterred from coming forward, and it could be a minor injury, but they might be disinclined to do so because of the attention that might come with setting that number back to 0. So it's just being mindful of those dynamics. We absolutely want to monitor those numbers as the management team and the EHS team, but it's just being mindful. If that deters people from interacting, maybe it's not the best thing to be doing. So after one of our workshops, a site director at one of the sites came back saying, I want the screens taken down. I think this is actually going to inhibit people. If people can hide stuff, they might because of that. So that was just one action, but it didn't come from the EHS team coming in as the experts. It actually just leaving a bit of time for some of that to resonate with our teams, and for the decision makers then to come forward with that. And I just found that to be much more fruitful to have that piece there. So that was just, as I say, as a philosophy, we're 100% aligned, but just be mindful as the target piece, just be mindful as to where that might go. And we've seen some disasters happen globally with crews that had, or organizations that had 0, and then they ended up with massive disasters as well. So I'm presenting this, I suppose, communicating events, a safety cross, and it's not so much as saying this is something that many people might like or they mightn't. It's just showing some of the learnings that we've had and how we've changed communications. So it used to be the cross on the left, right? And one day I was updating this at one of our notice boards, and an operator passed by and he said, I see that we're all safe. And I said, how do you mean? And it's just when you look at it, the messaging we were giving was the days that people did not interact with our safety management system, the days they didn't report an event, we were telling them that this was green. That was a good day, if you look at the programming. So then we actually had to think about that. We were saying, actually, it probably is not that's saying that no news is good news, really, which is contradicting where we're going with our first principle. So we changed it over just to a blank cross, and you can see the interactions. This is just for local areas that you can actually see locally over the month, events that were raised, were they incidents, near misses, or were they good catches. So it was just changing that communication and that message that was there as well that we thought was important. And again, we took out all the information about recordables and that kind of thing, because actually we found our frontline teams, it wasn't something that they took any heed of anyway. And sometimes it could just be an inhibitor there with the days from the last time accident and that kind of thing. So that was just one of the practical things that we done. And we were asked, was there any religious undertones to this? And there absolutely wasn't. It was just something that was there. This could just be a blank calendar, a square calendar as well. But it's just a changing in our communication, in how we put our message out there. So now I'm just going to look here at learning from normal work and work as imagined versus work as done. Some people might be familiar with this. This is the plan, the work as imagined, and it's all flat and it's plain sailing. The things we do to keep people, plant, environment, etc. safe. And it's designed to reduce our risk as low as we possibly can. But as we know, then you have reality, the work as it's actually done. Sometimes we exceed our expectations. We can get stuff done faster, or sometimes there can be challenges. Some of these things could be down to the training. It could be down to the tools. It could be down to, the procedures that people are working with that can lead to this. It could be external factors, that can actually lead to that as well. Is there a shortage of containers leading to maybe traffic management issues? All this kind of stuff, that these challenges can come up. But it's just acknowledging that there is a difference between work as imagined and work as done. And sometimes then we can actually have these emergent hazards that will come the way as well. So really what we're trying to do when we're learning from normal work is trying to identify some of those gaps and see what those emergent hazards are. Because it's the people who are out on the plant doing the work are going to see these as they come about. And if we have a heightened awareness in our teams, then we have a better chance of actually identifying this. And if the psychological safety piece is present, and we really are walking our talk in relation to no news is not good news, hopefully we will hear about this. We have an opportunity to take action to, widen that gap again, because we don't want that piece being there. We just want to be as close to the plan as we can and change the plan if needs be. But it's just trying to prevent these undesirable events from happening. So that was just the learning from normal work. So underneath that, then I suppose courage to care conversations. We used to call them safety talks, and our global team called them courage to care conversations, which I think is a much better term. This again is on the HSA website. And if you look here, these are 10 prompts. We ask our leadership teams to go out and just do one of these a month. Like, we don't want to make, and I know Dave Proven and Drew Ray have a paper called The Work of Safety versus the Safety of Work, where they contrast and compare the two. We don't want to be adding a bureaucratic piece. Ideally, you wouldn't need to measure this, but we do have to demonstrate that we are actually being proactive. We want to demonstrate where we're building capacity. And one of these ways, we believe, is the courage to care conversations. And if you look at these questions, right, that we are asking people to do one a month. If they want, they can do 10 a month, but at least one to log it. What are you working on today? What challenges do you face? Is there a procedure for this task? And being open and honest, can you or do you follow it? Where is it easy to make a mistake? Do you have the right tools and PPE for the job? What is unpredictable about your work? Is there a job or a task where you regularly need to find workarounds? Is it easy to get support if something goes wrong? Have you logged it on our safety management system? And if yes, was that useful? What you might notice about these 10 questions is that none of them actually ask about safety. They're all asking about work. And our workshops are the same. When we have a dialogue session where I use one of Dave Snowden's methods, the future backwards, it's asking about what's helping or hindering us get our work done. And what we have here is open-ended questions to encourage curious conversations. And it really is to learn about the work. And sometimes if we ask about safety, people will tend to come back and think about risk assessments or maybe some chemicals or ergonomics. But what we're looking to get to here is the more holistic viewpoint. And maybe it's down to a scanner gun not working that people might not associate with risk, but actually psychosocially, they actually might be distracted now because the scanner isn't working, there's a few workarounds. So maybe that's something that can show up, and that can show where people's minds actually aren't 100% on the process because of this workaround that's happening. So it's just an example of some of that. So this is something that we're doing, trying to encourage leading metrics as well, is that courage to care conversations. And as part of that, it's building trust. You're having your senior leaders come out, and it's coming out like one or two people coming out to have a conversation with someone on the floor. And it really is that humble inquiry piece. You know what I mean? You really want to come and find out, listen to the experts. You're not coming as the expert. You're coming to listen to the experts who know how to do the job best and try and learn from those. That's kind of the shift that we have there. I know people do Gemba walks, which are great as well, but this really isn't about a find and fix piece, and it's not about observation as to what can be fixed. This is about conversation, and it's deeper. We can observe, but that doesn't necessarily tell us why people are doing a task a certain way. Conversation is needed for that as well, for some things that mightn't be obvious. So I suppose here then you're trying to develop leading metrics. We have an app here for gathering the courage to care conversations, and it's looking at some of these leading metrics. So previously, for example, if we were looking at plant of the year, the criteria historically might be lagging metrics. So now we're saying, okay, what are we doing to build capacity? And some of that actually are these courage to care conversations. We're getting out there early, we're learning from normal work, and we're taking action on that. So if we're having more of these, that's great. How can we remove barriers to information? A lot of the times our safety management systems can be over here. Our management teams might not interact with them all that often. So how can we pull that into a dashboard that's readily accessible to people on our sites to be able to see those metrics and hone in on those? So if we're having site visits from our senior folks, that these questions are being asked, and that the pressure isn't on our EHS teams to try and get traction going, that it's actually, the whole site leadership teams will actually be owning that piece. So that's the barriers to information. And then if you want to look at making the circle bigger, next Monday I have a workshop with some safety reps. So it's like, might they be interested in doing some courage to care conversations? So it's just trying to, make the circle bigger, I suppose, really, and have more conversations and try and identify the risk and take action. And going back to what Olligan says, if things are going right, they probably won't be going wrong at the same time. Do you know what I mean? So if you're actually trying to get out there ahead of and identify the risk, take action, then hopefully we'll be spending less time in that reactive space where we are having, incidents and investigations as well. So that's kind of the hope of this. So the other piece then is learning teams. It's another practical piece here with learning from normal work. So we have, what we had done up to now is we had deep dives, for big messy, that you're trying to get your head around some of the challenges, and it was getting big teams together for a long period of time. Where we're going now is we're trying to make this that it's a lighter one, like for like an hour and a half with our teams, where we will prepare, we'll decide the scope of what we're looking at, get the right people in the room. We will go through, try and talk step by step as to what actually happens to learn. Then it's bubble or soak, people would call this, and it's like you give people time to actually go away, gather more information if they need it. Maybe we need other people back in the room. So it could be a day later, a week later, come back then and explore the improved piece. And from there then exploring actions. But in the learn piece, it's not about jumping ahead to the find and fix, that solution finding piece. It really is about learning about how this is done. So we've had some of these now, I'd say, for bigger items, but one we had recently was our EHS team and our maintenance team. And I know historically in many sites that this can be a challenge. So it's just like when an event is raised and work orders are needed to complete some works, how is that getting done? Where are the blind spots between the two? Where can stuff fall between the cracks? So having a learning team and discussing that, and there was learning said from all sides in relation to that and some of the improvements that were brought in. And again, from a completely just altruistic sense, like trying to understand everyone's role in this and some of the challenges they face. And it's not right or wrong. It's just now we're in a better position. We can make better decisions with the information that we can get out of these learning teams. So, and empower the experts. And this is just an example of one of the learning teams that we had, whereby, and this, I suppose, this is a stock photo here, just showing some flow through racking. So we were having some challenges just around racking, for example, and the interactions with forklifts and putting loads in at our sites. But when we had the learning team on that, we found out that, yes, our forklift drivers get trained and they're competent. And, when our regulator comes, everything is laid out exactly and they're meeting that criteria and it's all good. But their training, when they actually did go to our external training provider, was on static racking. And when they come back to site, then they're dealing with flow through racking, pushback racking, and static racking. So this was a big gap, So again, if people are talking about behaviours, it's about looking at, you could take that as an observation and say, oh, someone has loaded something incorrectly onto our racks, or actually have a conversation and find out actually there are gaps here and take action on that. So it's looking at the system holistically, you know, and trying to identify the gaps. But in fairness, we had an amazing crew at one of our sites. They went away and they worked on this very passionately, developed training, which has been rolled out to all our sites globally. And there's great feedback on that. But there was a gap that we weren't aware of, you know. And as the saying goes, like, you don't realise what you don't know until you realise you need to know it, you know. But it's brilliant to have this. And it's just one example that came out of that deep dive learning team. But that wasn't just getting our operators, you know, in relation to the racking. It was also bringing in our fleet manager, you know, from our forklift trucks. It was bringing in the procurement folks who actually negotiate contracts, that they could see some of the challenges and why some of the asks were coming for maybe different type of, you know, counterbalance trucks or bulk trucks, or, you know, if we're looking for various other trucks, basically, you know. So that was just one of the one example of one of the outputs that came out of one of those learning teams. So just to finish up, I may well be gone over time. I just wanted to call out here that UCC came in and done some research into our program. And just there were just two of the examples here that do you feel safety has or has not been impacted following the implementation of the Courage to Care program? And 83.3% said, yeah, it has been positively influenced. 11% were unsure, and there was another, my maths isn't great there now, but a very small number said that it wasn't. And over here on the right, then, how would you compare the Courage to Care program with other safety programs? And 100% said it was better. So look, it's just an example of what I would encourage people here to do is, you know, we're looking at the theory and the research, and sometimes we can get stuck. But like this was with UCC reaching out to the crew there who are doing their we're overseeing the masters in health, but like they have students who don't have a workplace who are keen to go in and actually research something. So I would encourage anyone on the call who has something that they'd like to research to actually avail of that. I think it's something that's you know, it's worthwhile doing, because sometimes we're so busy in our day-to-day. It's nice to get someone from external to come in and to see what we're doing. So look, it's we're, as I say, we're on a journey. I want to say Gaurav Mahagwiv and thank you. But I suppose that's my piece there. So I hope that was okay and made some sense. I could actually spend a week talking about this. I think it's fascinating subject matter, but obviously we only have our hour or hour and a half or whatever. So I'll stop sharing from there. Is that okay?
That's great. Thank you so much, Marion and Colleen, for that. Really appreciate it. So insightful, so interesting. And again, as you said, all up on our website. I'm just conscious of time now. It's 11:59. So I know Colleen and Marion are just going to have some questions on that fireside chat together. And I'd remind people again that if they have questions, to put them into the specific Q&A chat, and I will go through them at the end. There's some coming in there. But again, I suppose Colleen and Marion, take it away there, the couple of questions that you have. Thank you.
Thanks, Elaine. Thanks, Marion, as well, just for going through that. Really, really good to hear. So I just wanted to say, I suppose, start off by asking you mentioned psychological safety quite a lot, and why would you see that as something that's really important?
Well, I suppose if our teams don't feel like, I don't know, you can go back to Maslow's hierarchy of needs on this, but if it's not safe for people to come forward, they're not going to tell you. And I suppose you can look outside of our own organisation, and that you can look at healthcare. I think it's a great example whereby, you know, if mistakes are made around medications being administered and stuff, if people are afraid that they're going to face disciplinary, or if there's a punitive approach in that, they might not be inclined to come forward. So it's really about making it safe for people. Yeah, it goes back to that no news is not good news piece.
Yes,
and
yeah.
you can't fix the secret, to go back to what Clive Lloyd has said previously. And it's about, just like people's bread and butter is number one, you know what I mean? Maslow's hierarchy of needs. So if there's any threat to that, or if and especially I think this is something to be mindful of with contractors. And I've seen that historically in my career, whereby, you know, contractors often feel, and I talk about subcontractors here, like, you know, if you're seen to raise or make a bit of an issue there, you might be invited back. So it's really about trying to change from that, because there are risks out there, and we're much better off knowing about them. as not knowing about them. And if we don't have psychological safety where people feel respected and that they won't be punished, then, you know, that's not going to be the case. And actually
A really
earlier on,
key part then, really key, like to success in all the kind of interventions you mentioned. It just seems like it's just really key.
it is. And even earlier on in your presentation there, you mentioned just culture. And just to differentiate there as well, because you can have a restorative just culture or a retributive just culture. And there's a really good video actually that Sydney has done with the crew in the NHS Merseycare. It's called Just Culture, the movie. It's on YouTube. It's a half-hour long. It's well worth a watch. And that shows the difference that's there. And actually, there's a brilliant business case. You know, I think they saved conservatively 2 million a year by shifting from this retributive to a restorative just culture. And it's empowering your teams. And when we're working together, we're better, we're performing better business-wise, you know, our performance, health and safety-wise, you know, everything is much better.
So if so I know you talked about 3 actions in particular, the changing how you communicate in terms of accidents or safety generally, going from the kind of very green cross to the one with all the buried information on different types of events. And you talked about the courage to care conversations and the learning teams. So the courage to care conversations being really looking at that quality of conversation between manager and or supervisor and worker. And then the learning teams with where you were where you felt like the FLT guys were shaping their own training. So I just wondered, out of those 3 different actions or interventions, is there anything that, or if you had to choose one to go again with in terms of impact, which one would you choose?
I think the learning teams are great. And it's just about, like, look, as health and safety professionals, we have to demonstrate metrics, you know, for this stuff, but it really is about the everyday. It's about the meetings you attend. It's about the curiosity, about being mindful of bias, about being mindful of, are we learning, you know, and if so, are we communicating in that way? But I do think for difficult work, everyday work, I do think, like, having those conversations, getting the right people around, not just talking to one group in it that have a frustration, but actually getting the various players around the table so they can actually get it, and to facilitate that in a way that actually hears everyone. And, you know, it really is important. Human factors are, it's so important to the success of our organisation. We can have all the right, I actually have a picture. I had some colleagues over there a couple of years back, and I took them off down to Kerry, down to see the sites, and we went up to Moll's Gap. And, you know, up there, there's no layout in the car park, and actually there was a mound of, like, stone, you know, it's a bit haphazard up there. And some tourists came with a car and actually parked just, like, right up. There was an empty car park. And I was like, I wouldn't care to be getting that car back. So you can have the best car, you can have the best car park. It's that human factors piece is real, but, like, why would somebody do that? And you have to, observation on its own doesn't cut it, but it really is about, you know, trying to understand, like, and with that, just go from there, but just trying to meet people where they're at as opposed to being judgy, which we all do. Like, it's part of being human, you know.
So going back to just some of the actions that you did take in terms of challenges or any resistance to the work you carried out, did you come across any challenges and how did you overcome them?
Well, I suppose if we look at the road less travelled, and I would say that's in my career now as opposed to, you know, going back historically. Yeah, sometimes I went in as the know-all, and that probably wasn't the best way to go, because you realise very quickly people are not, they don't spend too much time in your presence if you're the one that has all the answers. So it really is about being humble. And that's one bit of advice I would have. Try not to be too impatient with some of this. It really is, it's a slow burn, you know, in trying to get some of it to filter down. I thought of something else there now. Sorry, my train of thought just went from me.
Yeah, anything else, I suppose, that came up for you in terms of challenges, maybe between teams or within teams?
And I think an example here might be actually, again, what are people being measured their success on? So if you have, I don't know, and I'll give that example again of maintenance, because again, this is historically something I've come across. I think it's relevant for many organizations, whereby we're going out saying no news is not good news. There's going to be more interactions. We are going to hear of more risk, and more actions are going to result from that, which is a great opportunity. But that means more work for the EHS team, but it means more work for maintenance teams as well, a lot of the time. So how do we manage that? And are we being fair to our maintenance team and meeting them where they're at? So just so we know, we have preventative maintenance, and then we have some of the stuff which is reactive. And some of it actually is calling out maybe for our engineering teams, that some projects may be required to change some layouts or whatever. It depends. But it's putting yourself in the shoes of those folks as well. And are they being given extra resources or not? And if not, what's the trade-off? Are we all clear on that we don't have unrealistic expectations of some people? And this is the realities of the everyday work as well. If your engineering team's success has been measured on the number of CapEx projects they get done, and you're coming for support in, something that isn't in that space, you can understand how there can be reluctance. So it's really about looking at the design of the organizational dynamics and the supports and where they are, and highlighting if some of those are needed. But sometimes folks can resist, and it's not that they don't want to help, it's just their success has been measured elsewhere. So it's trying to have an understanding of that, going in with that humble piece. And with that, then maybe with decision makers saying, look, there is a gap, or we do need more of this, and, just appealing and planting seeds that way,
And then I suppose maybe we should come to a close soon with our chat. But I suppose one last question I'd have is, if you were to give somebody a top tip who is taking on any safety culture work, what would be your advice? What would be your top tip?
I would assume that people are doing the research already, that they have gone out and they've gotten the books, or they've listened to the podcast, you know what I mean? They've read the research. There's a great, I probably should have had a list of stuff there. Maybe I can send on a list to you that you could include in the email or something, of some of the podcasts that I would listen to, or the books that I would read, or the researchers that I highly regard. So that piece is kind of taken for granted, that you kind of have some of the theory. But sometimes I think we can get stuck in the in the perfection. Will I do? And I've been there when it comes to the learning teams. You know what I mean? You're actually saying, but is this the right way? I better check that book. And what does this fella say? What does that? You're actually going out there checking. So do you know what? Actually, I found, go into a room with some your paper that you can write up. Get the right people together for an hour and a half and just talk through some difficult piece of work. And let's talk through step by step and see what learning is there from that. It's just trying to understand how the work is done, and let people go after that, say, we're going to come back now, and is there anyone else we need for the next session? Any more information to gather? But it's just that piece of like, what's the worst that can happen if you go in with some markers here with people to have a conversation and to note down what has happened? Sometimes we can just get stuck on the perfection, and is it the right way? And it's just about looking at some of what we do. What's our purpose for doing it? Is it actually delivering on what we're hoping to achieve? And I think over the years we might have just trying to declutter, I suppose, really. There might be some workarounds our EHS teams are doing with safety management systems, or some bureaucracy that mightn't be necessarily a value add. Can we do something better with that? So it's just about looking at some of those aspects and zooming up and out really to see the bigger picture, like where this overlaps as well with HR or other departments as well, and try and collaborate,
So not going for perfection, and listening to the stories on the ground, I suppose, is what you're saying.
Yeah, as a perfectionist, I'm challenging myself there, but I know what a stumbling block it can be, and that it can actually inhibit action, so it's just trying to sometimes to say, done is better than perfect, and it's not taken from you. You absolutely need to plan accordingly, and put in your groundwork, but just not to don't let it be freezing you from acting as well,
Yeah. Okay. I think I'm thinking of time here at 12:10. Maybe we should call it a day on the Fireside chat bit.
Great. Yeah, that's great.
Thanks,
Thank you so much again, Marion and Colleen, for that. So insightful. Thank you very much.
Brilliant. Thanks. That's all the best. Bye.
Thank you. Bye. Bye. Bye.
Thanks.